Energy. I'm the Chief Medical Officer of Partners in Health. And I'm extremely honored to have the awesome task of introducing and facilitating this conversation between three of my heroes, people I've worked with for decades now. Dr. Westlaire Lambert, the Executive Director of Zanmi Lasante, Dr. Reginald Fils-Aimé, the Director of Strategy and Planning for Zanmi Lasante, and Dr. Patrick Ulysse, the Chief Operating Officer of Partners in Health. I'll provide a little bit of background. I think most of you who've tuned in, who care about Haiti and follow Partners in Health, know that Haiti has a rich and proud history of being the first Black republic, the first country where racial equity was part of the foundation of the country and human rights. And in the words of many of my Haitian friends, that is why Haiti has continued to be punished by the world for this display of righteous indignation in the 1700s. And getting independence in 1804. But today what we have, and so Haiti has had a tough road of economic and political isolation, occupation, dictatorship. But in these last few years, since the shocking assassination of Jovenel Moïse, the president of Haiti, Haiti has plunged into ungovernable kind of chaos with gangs and violence taking over the country, with the lack of institutions functioning. And as a provider of healthcare, as we are at Zanmi Lasante, and a provider of, as Dr. Milian said, the right to health, we do try to work alongside the public sector and the community. And yet what we see are these very public sector institutions that are crumbling before our eyes. And so we, Zanmi Lasante, we support 17 facilities across almost 4 million Haitian people, providing all kinds of care, from basic community health care to the more sophisticated care we can provide at Mirabelais. We have a staff of 6,000 Haitians working all the time. And the strength of our work is because of our Haitian staff. The strength of our work is the just enormous bravery that it takes for a community health worker to be walking in an area that may have been 2 days before under gunfire to reach a pregnant woman, a physician who goes back into the hospital after it had been attacked by gangs, a nurse who is spending nights at the bedside of a person who has had a gunshot wound. These 6,000 strong Haitian staff are doing their best every day, in many cases providing the only medical care that is now available in the country. Yet we have had to scale back our services. It is hard to keep our staff safe. Our staff is separated from families. Their families are often unsafe in Port-au-Prince. And so we have had to lean into one another, and of course to all of our generous donors who have supported this work, despite many around the world just neglecting Haiti and paying little attention to this deep humanitarian crisis that is embroiling our neighbor just 90 miles from Miami. So I've introduced our amazing speakers already, but I'm going to start with my colleague and good friend, Dr. Patrick Ulysse, our Chief Operating Officer, and ask you, Patrick, if you can share a bit about the current conditions in Haiti, the violence and the instability, and how you see that and you're working on how to mitigate the impact of that on the operations at Zanmi Lasante.
No, thank you. Thank you so much, Joya, and thank you for everyone who make the time to join our conversation today. As I say, like, I don't think like sharing about like what you see on the news or what you heard from other colleague or other team you're working with, or what you hear from the news. I don't want to I don't want to like repeat or focus on those things today. And that's one. Another key things about the context also, it's I know like Port-au-Prince, the capital, it's one of the things we aligned a lot, where it's sad, a lot of crazy things is happening, but at the same time, most of our work are in Plateau Central in Artibonite, which is, as Joya mentioned earlier, we got like more than 17 facilities that's still working and still opening. Now, today it's clear it's challenging, where we have our staff having their family in Port-au-Prince. Like they cannot go back to see their family. They kind of worry about their family. As a result, like we have like that impact their well-being on the ground. That's one of the things. Today, last weekend, we do have people trying to go to go back to Port-au-Prince. Like it's completely impossible. And another key things also with that have been challenging our supply, like how we move supply from one place to another place is another like question we got on the table. We keep trying to figure out, but also with it's challenging. We heard like from FAO, like we got like more than 5 million people today was coming on like food insecurity. And we know what does that mean, like when you cannot access like to basic things. Basic food is one of the key things, part of the context. But also we do have stuff stock at the port in Port-au-Prince cannot move. But despite all of that, as Joya mentioned earlier, and you can hear from Millian on the video, we didn't stop pushing and do what needs to be done. For example, we working together with Zanmi Lasante from Haiti and also from our team from the coordination side. Here we have been putting in place a crisis response team. We call like the incident command, where we have our team like keep continuing to figure out together what is the best way to being nimble, but also adapt to the situation. Like sometimes we try more than like once, more than 2 times, more than 3 times. What is the way to move a drug from one space to another place? Can we try Adaptation? Can you try the border? Can you try, like we try everything, where we keep continuing to follow the goal to make sure that that drug can meet the team. I think Fizeme and Dr. Fizeme and Dr. Lambert will talk more about what is going on, but the emergency hospital keep continue to receive more than if they continue to use more than 100% of their capacity. Like patient didn't stop coming. And I was on the call earlier with one of the team in Atibonite. They say, no, we got our occupancy bed is more than 90%. That's when patient is still coming, not only from the catchment area, but people coming outside of the catchment area to try to find care. It's sad and it's worrying. For example, like fuel, knowing we don't have like reliable power on the facility. We rely on fuel, but fuel become one of the big challenge today in Haiti. Sometimes you cannot find it. When you find it, the price is really high. We didn't stop doing that, but the team also have been rethinking, how do we prioritize some services? Or do we make sure our emergency are 100% completely available? Do we need to, we're thinking on our patient to sit like all day the way we used to do it, or we thinking about like have specific way to it? The team didn't stop, continue to be nimble, adapt, or figure out different way to make sure drug can move from one place to another place, to make sure we balance and manage the resources we have available in that moment of the crisis. I will offer back to you, Julia.
Thank you so much, Patrick. I mean, you have really highlighted for us the complexity of the logistics. I mean, just this, for us, we complicated level of logistics we have on the best and easiest of days, trying to get food, fuel, medicine, staff back and forth. But right now, all those passageways have become so difficult, and so that's so helpful for people. There are many of you who've reached out and asked us, how can you help? And I think trying to understand is part of helping, and then we'll talk about ways to solve that, or at least try to mitigate that. So I want to turn to you, Dr. Lambert. If you can give us a sense, understanding all these logistical pressures, how is this situation impacting the health of people in Haiti?
Good afternoon, everyone. Thank you very much, Julia. And this is a great opportunity for me as the leader of this team in Haiti to give you, some insight about the impact of this crisis on the health of the Haitians. It has huge impact, Julia, both on the infrastructure, on the staff, and on the patient. You probably heard from the news that many hospitals in Port-au-Prince have been loaded or, or been forced to close, like the General Hospital, the TB hospitals, one of the largest private hospitals in Port-au-Prince, they all have been loaded and closed. I can tell you, I have even like a personal story of the impact of this crisis. I received a call 2 weeks ago from a friend who has a parent hospitalized who need a blood transfusion, and they have the parents, they have the family ready to give blood for him, but they cannot go nowhere. They have to stay home because fear to be caught in crossfires. And I managed to get blood for him from Mirbale. At the same time, there is no air transportation. There is no bus, or like our vehicle could not travel to the road and take the blood to Port-au-Prince. And this is like a perfect example of how much impact this against violence and political instability have on patient lives. But patient today, even somebody is sick, they can't go to the hospitals because they have fear for, immediate fear for their lives. And patient who needs to who suffer chronic condition, who needs care, they cannot go to, they don't have access to this care. Pregnant women have to stay home and deliver home. So it's a very, 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 very tough situation. Even like economic instability and the rising of costs, have exacerbated the cost of basic necessities like food, drug, and everything. Patrick talked about that a lot. Like logistics, the logistics of all this have been very disrupted. So it's really affect every single individual living in that large catchment area around the capital city.
Yeah. Thank you so much, Lambert. And you and I were talking just before this about, the increased risk to people to even fall ill. And then there are delays in getting access, as you described so, poignantly with your friend waiting for blood. And then our difficulty in following people up in the long term. And, so many of the illnesses that anyone faces are chronic. And so those are really challenging. And so, I think I want to turn to you, Dr. Fils-Aimé, because looking at what it takes to bring these life-saving interventions that we do, whether they're emergency care at the moment someone needs it, or the long-term continuing care, what are the challenges your team are facing in terms of the strategies that we use to provide care at a time like this?
Thank you, Julia, and thank you everyone for joining us. Thank you for standing in solidarity with the Haitian people. There are more than 300 people here with us. So this is we greatly appreciate that. Your question about challenges, Julia, brings me to really the reason why I joined Zanmi Lasante. I remember the challenges of my mother from the rural area in the south of Port-au-Prince, in Glacier, from the mountains, going under the rain, crossing rising rivers with me, who I had asthma, and taking me to the hospital in Port-au-Prince. There are some scenes that I remember, although I was a kid, because they were very dramatic scenes. And this is one of the reasons why I joined Zanmi Lasante, because Zanmi Lasante is an organization that is finding ways to overcome these challenges. So what I'd like to do to answer the question, maybe to go with our audience, maybe list a couple of challenges, major challenges that usually our patients face and that we overcome, and how this situation is making it much more difficult right now to address. There's a survey that has been done for many years in Haiti now, the MUCIS, that consistently have been saying that the two major reasons why people don't go to the health facility are money, because of the cost, and because of the distance. And when I joined Zanmi Lasante, and since 15 years ago, since then, and before, the way we've been trying to overcome these challenges, for example, for the distance, we serve people who live far in the remote areas. We work with community health workers, and community health workers, they help us overcome the geographic barriers to care. Well, at the same time, we're trying to build health facilities closer to people, but also working with community health workers. And community health workers, they have motorcycles, and they go on foot and visit our patients. There are ambulances that we send. I am on groups where we are receiving demands or calls to send an ambulance to this area to pick up a pregnant woman to take to the hospital, and mobile teams to also to go to the communities and provide care. So that's how we are doing it. But right now, as Patrick has been saying it, as Dr. Lambert is saying it, all of these are being more difficult to be done. It's more difficult for the community health workers to go to the community, because they need fuel to put on their motorbikes. But also sometimes, even though they are well known in the community, they have ways to go around roadblocks, but it's more difficult. Ambulances also having more difficulty to send ambulances because of fuel, and mobile team as well. But since then, as Patrick mentioned it, we are not surrendering. I have an example of a team in a program of maternal and child health we have in several of our healthcare facilities. When this new peak of this crisis hit, the first thing they did, they took the list of their patients. They look at the list and see which of our patients are living beyond the roadblocks, beyond areas that are affected by this crisis. And so they listed those who needed to be called. They took their phone, they called all of the patients one by one. Some of them maybe needed to come to the hospital. If they need to come earlier, there's a maternal health, maternal home, maternal home, a birth home where they can wait until they give birth in the hospital. And in this place when we have the women waiting to give birth, then we have to feed them. We have to take care of them in this place. Again, that's even more difficult because, as my colleagues have been saying, it's more difficult to find food right now. But yes, so this program, this team, this is just one example, have been calling people, linking them to either asking them, helping them to come, or maybe if they don't need to come, link them to a community health worker, working with the community health worker to go to this patient and give the care that's needed, either whether it is medication, the community health worker can pick the medication in the hospital and give to the patient. But also there are the economic barriers. We give free care, affordable care to people, and also we provide social and economic support to people. So that's how we address that part. And the last one really, which is also a barrier, is quality. And Patrick has been saying that people are taking risk, and Milia said it in the video. People take risks, and I've been amazed by people crossing areas controlled by criminal groups to come to care. And when I ask one patient, oh, you cross several towns in some areas controlled by gangs to come to the clinic. Why? And he said, because of the quality of care. So really, but to provide quality, the staff needs to be well. And Patrick explained that the staff right now, some of them cannot go home, so they have to stay. So we need to host the staff, have the means to support the staff in any way while they are providing care. So I can come back to that, but yes, those are some of the many challenges and the ways we are trying to address them in this situation.
Thank you so much, Dr. Fils-Aimé. I mean, I think, several of the points you made are so important, which is that we do have systems that work. Even in this terrible crisis, we have systems that work, and we know how to make them work better. But that is what requires this kind of emergency funding, because we can get mobile clinics out. We can get, patient transport in, but everything is expensive. Everything needs more support. And so one of the reasons to have this kind of informational webinar is to really help our amazing partners around the world to appreciate this and really contribute to helping Zanmi Lasante to do the things that we're good at. And I want to turn it back to you, Dr. Lambert, because I think one of the things you and I have been through, fires, floods, earthquakes, plagues. I mean, it's biblical, and yet I think with each of these, we've had to adapt. We've become often stronger afterwards, and usually by intention. And Fils-Aimé mentioned the emergency care. Many of the very specialized doctors we have in Haiti now, Haitian emergency medicine doctors, surgeons, orthopedists, pediatricians, they're trained at the Mirabelais Hospital, which is what we built as a way to contribute to Haiti after the earthquake destroyed so much of the medical and nursing education. But I guess the question for you, Dr. Lambert, is what have we learned from these many crises? How are we adapting in this crisis? And what don't we know enough about? What do we need to learn in this particular crisis, which involves more violence than we've seen in many decades?
Thanks once again, Julia. And you said it, ZL has been in the front line of all crises in Haiti over the last 20 years. And we learn from each of them. And like you said, about the earthquake in 2010, the country didn't have that emergency care was critical. And then we built HUM and we operate the first emergency services in Haiti. And these doctors who were trained from our programs, they went to the southern region. Remember when we had the 2021 earthquake, they went down there and they treat people, and then they were there on time and saved lives. So we learned from each of these crises. We became stronger, as you stated earlier. We improve and increase our operation systems to be able to. It's not a big surprise that we continue to provide care today, whereas this whole region of more than 5 million people in the Western Department, there's nothing. And then people knock our door and they visit our hospitals to have access to care. Because of this, pool of, we increase the pool of trained specialists ready to provide, quality of care that Fizeme was referring to. So we also learn from, how to incentivize our staff, providing more support, housing, food. We improve, our mental health support to the staff, because as you know, this crisis has a huge toll, mental toll on our staff. So we improve that those responses to keep them motivated to continue to serve. If I go to a bit more details, over the last few months, especially after the attack on the Mibale Hospital, we use different strategies to be able to keep our operations. Like we had to air transport our staff to the northern region and drive them south to the to Mirbale and other sites in the central region. We also learned from previous crises, as I stated before. We built and increased the capacity of some warehouses in the region where we are working, like in Saint-Marc, like western part of the central region. We triple, the capacity of these warehouses. Same in Hesh and Mibale as well. So that's why we are able to stock. We used to stock about like 1 month of essential drugs and clinical equipments, but now we have like 3-4 months of stock. So that's why we are still able to keep our clinical operations. Unfortunately, we have to just prevent, because we don't know where all these where things will calm down. As we are working on other strategy, on other alternative, we have to decrease a bit our operations to be able to to save energy, fuel, and also so our stock can last longer. So all this have been possible with thanks to the donors who are very generous to our programs in Haiti, and this is why we all these investment today are having impact.
Yeah, thank you so much for that, Lambert. It's always amazing to me that how we look back at the last crisis and think, wow, that was easier than this one. But no, it's much more amazing to me to see that things we've built in the past, systems, capacity, spaces like warehouses, all of the 5 S's, abilities to provide social support. We talk about staff, stuff, space, systems, and social support. It's often building on that platform that allows us then to respond. And I want to give a big shout out, of course, to all of our non-clinical teams, the operations team, the teams that run the warehouse, the drivers who are risking their lives. I mean, this work is absolutely a team sport. And, both, of course, in Haiti, but the amazing folks that are trying to work through these issues in Boston and Miami as we try to get shipments across. All so important in how we sort of move forward and learn lessons and try to improve for the next time. So I'm going to go back to you, Patrick, and say, given all this, what we built before, but what we still need, what can you tell us about the urgencies right now in this big group of more than 300 of our supporters who are joining us today?
No, thank you again, Julia. Good listening to Dr. Lambert and Fizeme, to you. I think I will say like three big things like we really need today. The first one is we need more money, and I will explain why. One, we're talking about 6,000 staff working in Haiti. We're talking about 6,000 Asian, 6,000 people who know the context, who's working there and work every day with them. They are not, even like you have like movement of people, but you have that team there moving from one place to another place, keep continue to provide care. Or we keep continue to support that staff, it's key. We need more of that, like when we talk about like with that situation, it's difficult to the price to have drugs available in the country. And I think Dr. Lambert explained earlier, like we need to figure out a way to have more space to store those drugs and keep those drugs like for 4 months and more in one place, because it's not easy to move from one place to another place. I will say when you look at like HM, even like we try to cut like some of the to just make only the essential services available. But when you look at the data, you still have more patients to serve. That means you need more money for fuel, you need more money for drugs, because patient is moving on all the space, as Fize may explain, to keep continue to have that quality of care. The cost of the fuel, for example, I think we was talking about like $5 a gallon, but now the team is talking about like $10, sometimes $15 to have a gallon of fuel. And they need to keep continue to figure out a way to have those resources. And I will say, seeing more than 300 people on the call clearly express like you care. You really care about like the work PIH and Zanmi Lasante is doing. And one of the way to support that, as I say, we need more resources, more money. The other key things, we need like practical solidarity more than ever. What I mean by it, actually for the past 3 weeks, I think Haiti have been completely isolated, because like no fly, the border is closing, the violence is going more up more than ever. But we keep continuing to figure out, like try different aspects to address the needs of the population or of where we are working. Having people keep continue to advocate, talking on the situation. Please talk more about the situation. Bring more people to support us or help us like continue to address that need. For me, is a key request. Like the practical solidarity is more than ever. Today, when you have, it's okay to buy the drugs here in Miami to send it to Haiti, but the part is challenging. How do we come together? How do we shake different table, different door to create that humanitarian corridor that we were talking earlier before that call on that table to make sure that's available for that team? We need that level of advocacy. And last things, I think we need love. When I see like all our teams stay on the ground, sacrifice everything, keep pushing day after day. I've been in Haiti recently for the death of my dad. And I was there in 2021 for the earthquake. What I saw, I want to send a lot of kudos for our team on the ground. I want to send a lot of kudos for our team at the coordination who's working nonstop to figure out what is the best way to be fast, to work closely with the Zanmi Lasante team to provide what they need. It's not this clear way to do it, but we keep continue to figure out. And a big kudos also to all our donors who still believe on our mission when we say we do a preferred option for the poor in care. And in those kind of situations, this is where the group of people we choose to serve, which is the poor, are the most affected, are the more marginalized, but we choose to stand behind them, stand along them. That's what I say we need love more than ever. I want to stop there. Over to you, Julia.
Thank you, Patrick. And again, our condolences to your family on the death of your father. What a terrible tragedy during this time. Dr. Lambert, I'm going to turn it back to you for a couple last words. We have questions also, but do you have any final thoughts you want to share with us before we move over to questions?
Julia, I'd like to first of all give a special thank to our staff. As Patrick was said earlier, who are making sacrifice. And also, I'd like to underline, they are, many of them, they have options. We lost hundreds of staff over the last year, but we also have hundreds of staff who have options. They have, you know, a Canadian visa, a US visa. Some of them are, you know, they have a green card here. They could still live, but they decide to stay and serve. For me, these are the real heroes. You know, those people, you know, staying on the ground in the field like me and many others. These are the people that I'd like, you know, to thank especially. But also thank to everyone here, all the attendees, all the donors for the work that they have made possible in Haiti. It's your contribution, it's your current and past, I would call investment, you know, gift that allows ZL today to continue to offer life-saving interventions in Haiti to save these countless lives. Please don't give up on Haiti. Don't give up on us. We need you today, now than ever before. But we can make, you know, we have, it's because we, you know, we trust in this big beacon of hope that ZL is, that PartnersNL is. This is why we are here today. And this is why we are working together will make, you know, the life of Haitian better in the future. Thank you very much.
Thank you so much, Lambert. I mean, I think at the end of the day, the heroes are the people on the ground every day. I agree. So many have options. Many of you have options. And so, you know, I'm going to go to a couple of the questions. And I'll group them a bit. There's a bunch of questions about negotiating a safe corridor. And I would say one of the things that we're trying to do is to establish a humanitarian corridor, probably from the Dominican Republic. We wouldn't do that by negotiating with criminal elements, but we expect support for that from the international community. So if there's ways that you can reach out to your Congress people. Haiti desperately needs a humanitarian corridor to get supplies in there. So that is one of the questions that several of you have raised. And I think that would help people from all across Haiti, because the pressure point is Port-au-Prince. And someone asked about the peninsula, and that's also very, very complicated. So another question, and I'll give this one to, well, actually, some of these we can't really answer. We can't, right now, there's so much insecurity. We can't really disclose ways we move things about. We can say that we would love your support on getting a humanitarian corridor set up. We would love your financial support. And I think a lot of the things that, that you might want to know, we don't want to ever put our staff at any kind of risk. But, maybe Patrick, you can highlight a bit how we are working to get fuel from the Dominican Republic. And then Fizeme, I'm going to go to you about what you see as the way the international community could be helping. But so let's start with Patrick on the fuel, or Lambert, either of you, because I know you've both been involved in negotiations around getting fuel.
I will let Dr. Lambert take the lead on that question for the fuel. Yeah, over to you, Dr. Lambert.
Thank you, Julia. Thank you, Patrick, and thank you for the one of the attendees who asked the question. We've been working fiercely to get fuel from the DR. We've been working over the last 2 weeks. We wrote to the Haitian government to have approval to buy fuel in the DR. We've been in touch with several people in the DR to get fuel. The process is moving forward, I can say, from the last message I have this afternoon, but it's working through the government, it's quite heavy. So it takes more time than we thought. But we are optimistic that this will unfold this week. Also, thanks to Justin is a member of our PIH board who's also helping us to navigate through all these complexities. So I'd like to highlight that, Justin. Thank you very much for we even had a call on the Sunday afternoon to to discuss all these things. So we are pretty hopeful that we will get something done this week, but it takes more time than we thought. In the meantime, we are getting fuel at double, triple price locally.
That's great. And I do want to highlight the support from board members that people, if there are connections you have, if there are transportation companies, obviously we always need money, but there are many ways to help. And these are ways. And someone else highlighted the question of are there certain folks in Congress? Please reach out to your own Congress people as well, but there are people who have always been great friends of Haiti, like Maxine Waters, Barbara Lee. We have now Ayanna Pressley, who's been a great friend to Haiti, senators like Sherrod Brown. And so reach out to your own Congress people about this idea of the humanitarian corridor and supporting Haiti in that way. Fisame, you studied in the U.S. and in Canada. You've worked in Liberia and Haiti. How do you think about the role of international communities? One of our guests is from Germany and saying, what can we all do to help?
Yes, thank you. And I thank the guest for this question. First, a short statement about the fact that maybe emphasizing that then there are more needs right now and more severe needs, but also less the capacities or there are barriers and more barriers at the same time. And also mentioning also that there are right now the direct impact of the crisis on health, but also there are maybe there are threats to the future. We understand that if the situation continues the way it is, with people not being able, in Port-au-Prince, in other areas, not being able to access drinking water, you understand that there are risks of epidemics and especially the cholera epidemics flaring back up. And we understand also with the food insecurity that is in Port-au-Prince, but also the service has demonstrated food insecurity in areas in the Artibonite, for example, in areas controlled by gang in the Artibonite, where farmers have fled their fields and there's high level of food insecurity. So we understand that can lead us to also other diseases. Yesterday was the World Day, TB, Tuberculosis World Day. And so, and many other threats to the nation. So really, Patrick mentioned three major points. So that I really like: the pragmatic solidarity, the love that we need, donation, that is really needed, because we explained that how to do anything now, the cost is much higher than normally. And you stressed the establishment of the humanitarian corridor. And also, I think we need everybody's advocacy any way you can, also to really support the reestablishment of security in Haiti. And as Dr. Milia was saying, because the situation right now not only is the threat to the nation, but also a threat to many fundamental human rights, health, but also other rights, education as well right now. So we really need your solidarity that you are already giving us and standing with us. So I think, yes, any country, everywhere you can be, you can express, you can support the Haitian people right now.
And if there's one thing I've learned from my Haitian brothers and sisters and from the history of Haiti is that standing up and speaking out does matter. And, we've seen mass mobilizations around the world for many different topics. Many of us were involved in the movement for AIDS treatment access, for example. We'd love to see an international movement for, peace and justice in Haiti. I mean, that could be happening. And someone asked, what is a humanitarian corridor? Before I get to that, I want to just reflect, since you were talking about malnutrition, which Dr. Fils-Aimé is always on our minds. Haiti is the most food insecure country in the hemisphere, even without all of this. What is happening at our factory, which makes the nutritionally fortified peanut butter that we call Nurimamba? Are the operations there continuing? Lambert or Fils-Aimé?
Yes, they are continuing. They are still producing Norimamba, for the malnourished kids. We did have, issues and challenges recently with our containers being, held at the seaport. But thanks God, nothing happened to the containers. I have to say, with all these looting that you have witnessed in the news. But the Nurimamba facility is still running and still producing Nurimamba for the kids.
Thank you, Lambert. I mean, it's for you all to disclose what you want to disclose, but I've certainly, again, these are things that I've learned so much of from Haiti, which is part of our security is the fact that we are providing essential services for some of the, most poor and vulnerable people. And that is noticed even by, people who are in gangs and otherwise, maybe at odds with many institutions. Someone asked, what is a humanitarian corridor, and like how to advocate. I mean, a humanitarian corridor is often brokered by the international community to establish a route to get supplies in and out. So it's different than an occupation. It's different than an invasion. It's just some additional security, particularly for humanitarian assistance. And Patrick, there was a question directly for you. How do you see some of the more innovative strategies, like getting this dock in Gaza? Are there parallels we can play of getting things in innovative ways, through the water, through docks? Have you looked at any of those things in your capacity as COO, Patrick?
Yes, I will say, I know even before the past like 3 weeks, the team, as Lambert mentioned earlier, have been exploring different other way to move stuff. Like the border at the DR, Republic Dominican was one of them. We're working in Plateau Central, which is in Artibonite, which is the central in Haiti, but we have been using the north, start exploring the part of the north in the country, like Cape Haitian, to see how do we move stuff to that place, like to air or by the ocean, and after we'll continue to do that transportation. As I mentioned earlier, and this is the power of the nimbleness of PIH. We know where we want to go to kind of like serve the patient. We didn't stop. We keep trying. That strategy is not working. What else we will try? We use all the cat until we can meet the needs of the patient. Yeah, that's one way I can explore, answer that. Yes, we have been exploring different other paths outside of the normal path we used to. Yeah.
Thank you, Patrick. And I think to Lambert's point about this goodwill that, we are able to operate under, which is not under any false pretenses, it's just the provision of services. I think just for our supporters and partners to remember that, as we're doing this work, we're also paying the staff of that, salaries of thousands of people. We're providing medical care for many hundreds of thousands of people. We're providing food and education support to thousands of people. So the keeping the operations of Zanmi Lasante continuing during this time also can be a way to break the kind of cycle of stress and poverty, at least for some people and some families in some areas. And so I think it has a multiplying effect of not only providing the healthcare we need, but the ongoing kind of jobs and economic, at least some economic security for our staff and for their loved ones. So I think these are all, critical, important ways to support the work. I am sure, yes, we are recording this, and so you'll be able to share it widely. And, we want to really thank especially Dr. Reginald Fils-Aimé, Dr. Weslair Lambert, Dr. Patrick Ulysse, and please relay our deep, deep thanks to each and every one of your staff, from the drivers who are still negotiating roadblocks to the people who are keeping the hospital clean, the nurses who are up all night, the many, many residents that we have in training who are making the decision to stick with Haiti. Convey our thanks to all the staff. We miss them. And I want to thank all of you for tuning in, because this is such a critical time. And as you've heard, we need love, we need friendship. We need to keep Haiti in our thoughts. If you'd like to contribute to Partners in Health, please do. A monthly contribution is always really appreciated, so we can know what money is coming down the pike, and it helps our colleagues like Dr. Lambert and Dr. Fils-Aimé to plan the next quarter, the next month. And so we are just so grateful for every kind of support we get from all of you. So thank you all so much.